as usual, we'll be talking about NCLEX and then some content related to NCLEX. So I call it on the go. I come up with the case and then we work through the case as I give you the information. And so you help me come up with the diagnosis and I lead you to the case, how to go about reading cases in your NCLEX. I call them the buzzword. So what is the story? Our HPI will be basically what we have. Let's start with 25-year-old female. This is why it's a college student, right? So you have a college student and you present to the clinic. So you are in the clinic. So in the clinic with the following complaint. So basically, she said one, bloating. She's complaining about bloating. So you have to pay attention to the buzzword. 2, abdominal cramps or pain. And then she talked about loose stool. So basically, diarrhea, right? And then excessive flatus for how long? Maybe 3 months. This has been going on for 3 months. So this is a chief complaint. This is a concern. She's a female, 25 years. She's a college student. And then she came in with this bloating, abdominal cramp, pain, loose to diarrhea, basically excessive flatus, and then the 3 months duration of these symptoms. Does this give you idea? NCLEX will always will give you the open liner. Basically, I call this is the main chief complaint. They usually will put this at the first 2 sentences to guide you. Does this give you an idea, something you've read about? My clue is when you see this, you can see that these are all signs and symptoms related to the GI tract. So your brain should be going to GI pathology, GI problem. What GI issues will give you bloating, cramping, pain, loose stool, excessive flatus for 3 months. And that will narrow your conditions you should be worrying about. So you should be thinking about certain things that you think may be causing this problem. Don't talking about pneumonia. I won't be thinking about anything else except in the GI tract and narrow your thinking. These are the buzzwords you will see in the question that will be given to you. So I've given you 5 of them. What do you think? If you need more information, basically, if you need more information, basically, what are we going to say? Well, I would say the nurse got more history, want to find out more about the stool. So the stool, this is what the patient said. Patient said she goes about 6 to 8 times BM a day. And these stool may be pale in color. Okay, so they are pale in color. There's no blood in it, no blood. So that should be your buzzword, like no mucus either. But it look very oily or fatty in nature. What do you think? Does this give you enough information? Does it make you think about what I'm thinking about? Do you need any more information? Those are the information. 25-year-old college student, bloating, abdominal cramp, loose stool, excessive flatus for 3 months. The stool quality, 6 to 8 times a day. They are pale in color. There's no blood in it. They look oily and fatty and mucus. This is like a lecture, give you some idea. So what do you think? Right now, something should be ringing in your ear. So the nurse decided to get more information since the patient, you have not come up with an answer, the diagnosis. I give you more information. She also complained about fatigue, right? And then complain about what? Weight loss. About maybe 15 pounds. 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 over 3 months, right? Does that give you an idea? 15 pounds over 3 months. So those are what additional information you got. Does that give you a clue? Does that make you worry about something? Does that give you an idea? What do you think? So far, you should be thinking about few diagnoses, right? So the nurse continue to probe. It's okay. The symptoms is not associated with dairy product. So she can drink milk without any problem, right? But she said like when she eat some pasta or maybe some bread or maybe baked goods, the symptoms get worse, but she doesn't know. I mean, but there's no blood in it. She feel like she's losing weight. She can eat anything she wants. That's what is going to happen. Um, that's all you have. Well, a past medical history, she has none. There's nothing there. She's never had any surgery, so no surgery. She has no allergies either, and no medication. Does that give you a clue, right? 25-year-old, bloating, cramping abdominal pain, loose stool, excessive flavors for 3 months. Stool are like loose for 6 to 8 times a day. They are pale in color. There's no blood in it. There's no mucus either. They are not fatty in nature, right? She report of weight gain and lost about 15 pounds and some fatigue. When you investigate more, the symptoms is not associated with dairy products, so she can drink milk without any problem. When she eats some pasta, or some bread, she think like the pain get worse, but she doesn't know. She has no surgery, nothing like that. So, can you figure it out? If not, this is the physical exams. Well, the nurse decided to do a physical exams. The vitals are normal. They are normal. You don't see anything. But what you saw was BMI is like 19 kilo per M3. So that is the BMI. Does that give you a clue? This is the BMI of the patient. She was very thin, so physical, very thin patient, and a BMI of that. And she looked pale in color. So her skin is very pale. What do you think? You look at it and say the mucous memory is also pale in color. Does that give you a clue? Right? Does this give you a clue? You should be making a diagnosis right now. You should be making a diagnosis. I'm leading you. This is like a game, right? What do you think? That's on the go. The lungs, fine. The lung is clear bilaterally. The regular rate and rhythm in the heart. You listen to the abdomen is soft. There's no pain, no tender, but she's slightly distended. What do you think is going on? And she has bowel sounds normal in all four quadrants. Can you figure out what is going on? Do you get it? What about if I give you lab? And lab, hematocrit is probably like 29. Iron is low, and vitamin D is also low. What do you think is going on with this patient? What do you think is going on with this patient? What is your differential diagnosis? I see Crohn's. I see celiac disease. What else, guys? Those are your differential. What else can it be? It can be irritable. bowel disease, right? It can be lactose intolerance. So any other diagnosis you're thinking about? But this is the problem. This is the problem. Does that give you a clue? So if these are your diagnoses, you got to go through the differential. If it's supposed to be Crohn's, what do you think you should get in the history that tell you this is a Crohn's disease? What do you want to know in the history? Right? 25-year-old, bloating, abdominal cramp, blue stool, excessive flatus, mucus. There's no blood, there's no mucus, there's oily, I'm losing weight. The symptoms is not associated with the dairy product. I eat some bacon, bread, it can worsen. Can this be Crohn's? I can tell you it can be Crohn's because of why? Why would this be eliminated? Why? Why this cannot be Crohn's disease? Think about it. Why this cannot be Crohn's? Crohn's is what? Inflammatory bowel disease. The idea of inflammation should tell you that there should be some blood in your stool. Every time there's inflammation, you're looking for blood in your stool. So inflammation will give you some bleeding. So this is IB inflammation D, right? And so the stool is bloody. There's some blood, at least. Even though there's anemia, I told you there's no blood in the stool. Therefore, it cannot be inflammatory bowel disease. Irritable bowel syndrome. Why is not irritable bowel syndrome? Who knows that? Who can tell me why there's a buzzword for irritable bowel syndrome? This is like a GI lecture, right? Irritable bowel syndrome. The buzzword you're looking for is alternating constipation and diarrhea. I never said that in the case. Never said that. And there is a signs of more absorption. That means more absorption. There's a sign of more absorption. The anemia, the client has low vitamin D and anemia is a sign of more absorption. And therefore, and the client is not gaining weight. Therefore, cannot be. Lactose intolerance, the condition is not associated with the dairy product. So this rule out that. So this is a celiac disease. This is a classic celiac disease. This is the way the board will give it to you. It's a classic celiac disease. The patient is what? Young, bloating, crampy, loose stool, excessive flatus, losing weight. Stool is what? Fatty in nature. There's no mucus, there's no blood. The keyword, the stool is pale in color. That's another keyword you should pay attention to. She's losing weight. It's not associated with the fatty dairy product. When she eat pasta, bread, and baked goods, it gets worse. That's your clue right there. And she has no past medical history. This is celiac disease. This is how a celiac patient looks like. This is the buzzword you should be looking for when you're reading case study. And you should be able to make the diagnosis based on these key facts. You say, oh, I can rule out Crohn's, there's no blood in it. Irritable bowel syndrome, there's no alternation between constipation and diarrhea, and there's no malabsorption symptoms. Lactose intolerance, they can eat dairy products. When you're reading case study, every word that they give you, they said if they say no, 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 you always focus on no to rule out other problem, and you'll be left with your diagnosis. That's what we call differential diagnosis. Pay attention to no, no, no doesn't mean you should ignore it. It's a clue to tell you that whatever you're thinking about is not the right answer, because it's helping you eliminate other disease process and focus on the one that is the diagnosis. Therefore, how do we confirm this? Who know how to confirm this? Confirmation. What do you want to do? We do serology test, right? And then there's one more thing that you can do to confirm this. Who know how to confirm celiac disease? If you know it, you can type it. What do you think we're going to do to confirm the diagnosis of celiac disease? What do you think? B. With the biopsy. So they have to biopsy the small bowel. So upper endoscopy with the small bowel. You have to know the findings. For serology, usually it's a tissue diagnosis, the specific thing in the blood. Basically, we do a study in the blood and we'll see that we get IgA. You should know this in case they give it to you. IgA, these are all autoimmune disease. It's anti-tissue. This is the problem. Anti-tissue and trans is a glutaminase, basically tissue that we're looking for. This is what the blood test will do. But if you do endoscopy and we do a tissue, we biopsy the tissue, what is going to look like is what? The destruction of the villi. So I want you to know this. There's a loss of small bowel villi. So this is basically what it look like. So your small bowel, this is the wall. You have something like that. The villi like that. So it's like a finger-like projection all over. Finger-like, and then it can help with the absorption. In celiac disease, you don't have it. You have something like that. Very, the villi, very, very small. And so there's a lack of absorption. It's too basically passes through and they get into trouble. So loss of small bowel villi or the mucosa atrophy is the key. Okay, guys. So now, how do you treat this patient? The most important thing is gluten-free diet. For what? For life. And then the food diary. This is what you teach them. This is the basic of celiac disease, gluten-free diet for life and food diary. And they will ask you, well, what is gluten-free diet? Well, you got to tell them food to avoid. So what should they avoid, guys? What food should they avoid? What food would you tell them to avoid? Everybody know it, right? Raw, right? Some barley, some rye, some oat, some wheat. But this is not enough. Everybody knows about it. You think your body is going to ask you? No, they will trap you. They will put certain things in it. Mono, everybody knows about this, right? Everybody knows about barley, rye, and oat and wheat. What other food can contain gluten in it, but they don't know? One of them, everybody drink beer, right? Those who like beer, yeah, you tell them you can't drink beer because there may be grain in it. People forget about it. You can't drink malt. There's always also a grain, unless they tell you, yeah. So this is also a problem. You got to tell them you can't drink beer, you can't have malt, right? They forget that soy sauce is also a big gluten, and people forget about it. That is also another thing you need to teach them. And flour, okay, flour tortilla. So there's a lot of things they don't know. Tortilla, unless they tell you it's a corn tortilla, flour tortilla is a really bad one. You can't have it. And even rolls. So you can also don't have this problem. Bagels. I know we all like bagels. Well, good luck with that. You can't eat any more bagels. These are little things they will put in there. I know everybody know broad, barley, rye, oat, and wheat. But if you know this, you're better than another student, right? You're more likely to pass than somebody who just knows this because they will put beer, malt, sauce, and they know everybody know barley, rye, oat, and wheat. But if I put tortilla, it's what is this? I don't know tortilla. Yeah, it's also you may have, those are what we call hidden gluten. The worst one is this one. okay, is hot dogs. Hot dogs also has a hidden and gluten in it. And then processed food, most processed food. So if you don't know it and you think this is a processed food, you tell the patient you cannot eat this thing, because if you eat it, we have issues, right? So you teach them you can't have them. So what is good for them? What can they have then? If I can eat all this, I can drink beer, I can drink malt and other thing. What can I do? Well, the common one is corn. That one is easy. Everybody knows corn, potatoes, and rice. But there's other things too. They will put there that you should be able to know that this also is possible. Like I told you, milk product is okay. They can eat some milk product. They can have some cheese. It's okay because it doesn't contain any gluten. Avocado is also fine. Rice, brown rice is fine. Like I said, rice is okay. They can eat meat and poultry. Okay, you can eat meat and poultry. It's fine. Banana is also okay. And bell pepper is also fine. So just know all these things that is possible, but the most important thing, these are the food they need to avoid. Be careful, your board will trick you, right? This is not an infectious problem. So this patient is a standard precaution. Don't fall for it. Because it's not infectious, no antibiotic. These are NCLEX tips. Everybody will pick these answers. So I put the NCLEX tips. These are little traps that you should avoid, right? It's not infectious. It's an autoimmune disease. It's an autoimmune. Right? It's not infectious. There's no need antibiotic. The most important thing is just to avoid gluten, right? These are little things that if you master it, you will know for the little things that they will do and try to do it. Now, remember, because this is more absorption issue, you have to know a few things. This is going to cause problem, right? They're going to have what? Low iron, low calcium. They're going to have low vitamin D. They're going to have low protein. All these things is what is causing them to lose weight, to have anemia, and then they're also going to lose fat, right? So your replacement is vitamin ADK, this fat soluble vitamin. If you provide to this patient, they will be good. So what are the complications with this? Complication. I've given you a clue, but I want to see if you get a picture of what I did. What are the complications do you worry about for these patients? So if I tell you we have a celiac disease patient, what do you worry about in them? What do you think? These patients, little young patient, they are risks of osteoporosis. That's why we got to give them supplement, right? They're going to have iron deficiency, anemia. You also have to um, worry about that. And then the most important, this is serious. The most important serious condition. Does anybody know? Apart from osteoporosis, iron deficiency, anemia, there's one serious problem these people are going to suffer from due to the recurrent inflammation in the leading to the loss of villi is what? What do you think is the most important that you have to warn them? If you don't treat it, it's a long-term problem. Long-term problem. And that is lymphoma. lymphoma. So don't forget it. These are little things that your board will put over there. Worry about lymphoma because of the recurrent inflammation back and forth, back and forth. So osteoporosis, iron deficiency anemia, and lymphoma are big things you should worry about. So if I tell you the next examine the patient exam, so further assessment, this is what the client complain about. Um, Muscle cramps, numbness, and tingling. What do you think is the problem? What condition is think? Why is the patient complaining about it? Muscle cramps, numbness, and tingling. Why is the patient complaining about it? This is what the nurse found. Further assessment shows the patient has muscle cramps, numbness, and a tingling. What do you think is the condition causing this? You all go back to the major side effect of the client, right? They're going to, it's a more absorption problem. So just by that, you're thinking that something is causing this more absorption issue. And so why would she complain of muscle cramps, some numbness and tingling? The disease process will lead to what? Low calcium, protein, low fat, low iron. So most likely the patient has vitamin D deficiency or low calcium. This is why the patient is complaining about. So the questions are made from content. So if you know what this patient is going to suffer from, if I give you a question, it's right there. I told you osteoporosis is this, and you have deficiency of this. So that should tell you why this is happening. So if you have to help them, is to give them some supplement, calcium supplement. If you have to give them iron, you know what you're supposed to tell them. Teaching about iron, you have to know that. Your board can bring that. If you need iron, how do you take your iron? Do you take it with milk? Do you take it with vitamin C? Or you take it with food? All these little things, you have to master it to be able to answer certain questions, right? I say the patient has petechia, right? Why would this patient has petechia? Tell me, guys. Why petechia? Who can tell me why this patient has petechia? When you examine her, she has petechia. What is the problem? Why would she have vitamin A? Why would she have petechia? It's because of the content, right? I told you there's more absorption of fat. If there's more absorption of fat, they're going to have fat soluble deficiency and vitamin deficiency. And petechia is related to what? Vitamin K. So she probably has vitamin K deficiency. So I cannot put everything on the board, but when you're studying, these are the little things you need to pay attention um, to be able to be successful in your test, right? So they may give you a table and they say, hey, let's see if we can make a table and figure out two condition and maybe compare the three. Um, for example, as I said, why the other diagnosis is not a problem, right? So if I give you this condition, like, let's see, I say findings, I put findings here and I said celiac disease, and I put irritable bowel syndrome, and I say ulcerative colitis, right? Those are the to be able to distinguish between them, right? Distinguish between them. So if I put, let me say, I put it a bloody diarrhea. This is just to summarize it for you. Weight loss, pale stool, fatty stool, more absorption, like that. And then maybe I'll add more dicyclomine, steroid, like that. So you may see a table like that. It's just to compare. They're just trying to track you to see if you understand the content, right? And then you got to go through them and see which one is consistent with the problem, right? Celiac disease. Does it give you bloody diarrhea? Does it lead to weight loss? Do you have a pale stool? You have a fatty stool? Do you have more absorption? Do you need dicyclomine or do you need steroid? The same thing, irritable bowel syndrome. Do you have bloody diarrhea, weight loss, fatty, and all those things? You may have to like compare it. So let's do it together, right? We already know about celiac disease. Um, you don't going to have bloody diarrhea. Bloody diarrhea will be associated with celiac disease, ulcerative colitis because it's an inflammatory bowel disease, right? Weight loss. You're going to have weight loss with celiac disease. You're not going to have weight loss with irritable bowel syndrome. You're going to have ulcerative colitis. You're going to have weight loss, right? Pale stool is consistent with celiac disease. Fatty stool, celiac disease. More absorption, celiac disease, and sometimes ulcerative colitis. Who need dicyclomine is anticholinergic. Who condition related to anticholinergic and stress, irritable bowel syndrome. Who need immunosuppression? Some patients may need immunosuppression for celiac, but it's not used for it. Most of the time, it's ulcerative colitis. So this is the way you should think about the NCLEX content, and this is the way to summarize it for you. So this is something you should be good at. So let's summarize the question. Like I said, if you new, you just join us. We have a class coming up, adapting case in crash course. This is where to register. But we have a 25-year to register. You go here, and this is the content we'll be talking about. You get access to the on demand for 75 days, multiple questions on the Q bank, and you're going to master your content and to get you closer to passing your NCLEX. 25-year-old, college student, bloating, cramping abdominal pain, loose stool, excessive flatus. This happened for 3 months. The stool is pale in color. There's no blood or mucus in it. It's oily and fatty. Lost 15 pounds. She reported about fatigue. Food, the condition is not associated with dairy products, but when she eats some pasta, bread, and baked goods, it gets worse. No past medical history, surgical history, no allergies. She doesn't take any medication. The vitals is normal, but her BMI is low. She's very thin, pale in color, mucous memory is pale. Abdomen and exams is basically slightly distended because of the bloating. She has anemia, iron deficiency, and then vitamin D deficiency. Your differential, you have Crohn's because it can be Crohn's because there's no blood in the stool. Celiac disease, she has all the signs and symptoms. Irritable bowel disease, there's no alternating constipation and diarrhea. And lactose intolerance, she can eat dairy products, so it's not a problem. What is the confirmation? You do serology or you do endoscopy and you biopsy tissue to show you that. What is the treatment? Gluten-free diet for life, and then food diary to teach them things they should avoid. What should they avoid? Barley, rye, oat, and wheat. But that is not enough. To be smart, to be on top of your game, you have to know other things that have hidden gluten in it. Beer, malt, soy sauce, flour, tortilla flour. Corn tortilla is okay, but flour tortilla is not good. Rolls and bengals are not good. And also hot dogs and processed food. What can they eat? CPR, corn, potato, rice. But that is not enough. They may not give you that. Remember, milk product is safe. Cheese is safe. Avocado, rice, banana, all safe. NCLEX strategy that they will trap you is autoimmune. It's not infectious. You don't need antibiotic. But the problem they mixing, malabsorption issue. Complication, osteoporosis, iron deficiency, anemia, and lymphoma. That is the way to go. And I give you this table for you to be able to distinguish between them so that you see in the case, if they give you a case, they will let you compare with one of these guys. So you better know them. This is Adapt NCLEX. Thank you for watching. I'd like to see you in our crash course. Take care of yourself and good luck.